This video provides an overview of the VTI remotely operated suction irrigation system. Prior to use, please read complete operating instructions provided with the control unit and tubing sets. The VTI remotely operated suction irrigation system, or ROSI, is designed to put control of suction and irrigation back into the surgeon's hands. The surgeon at the robotic console manipulates the tip within the surgical field using the robotic instruments and activates suction and irrigation using a foot switch, all without assistance. The ROSI system consists of a tubing set, a control unit, an IV bag inflation cuff, and a foot switch. The tubing set is provided sterile and is intended for one-time use. The set consists of 3 limbs, as shown here. The suction limb of the tubing set is recognized by finding the yellow connector. This limb and connector hook up to the hospital suction canister. The patient limb of the tubing set can be recognized by finding the blue tip. The patient limb and adjacent tubing are used within the surgical field and should be handled using sterile technique at all times. The irrigation limb of the tubing set is easily recognized by finding the IV bag spike. This spike inserts into the IV bag used for fluid irrigation and should also be handled using sterile technique at all times. Now, let's turn to the hardware provided with the system. The control unit consists of an on-off setup switch, 2 foot switch connectors, an IV cuff connector, and 2 pinch valves, one for suction and one for irrigation. The suction and irrigation limbs of the tubing set will interface with the control unit at these 2 valves. The back of the control unit consists of a power connector and a hospital nitrogen supply connector. The IV bag inflation cuff is used to pressurize an IV bag, thus providing powered irrigation. The infusion cuff has an air line, which connects to the control unit. Finally, the foot switch consists of a yellow labeled pedal, which activates suction, and a blue labeled button, which activates irrigation. When setting up your ROSI system, please use sterile technique when appropriate to maintain sterility of the distal tubing set and IV bag spike. To start the setup of your system, first look to the back of your unit. Hook up the hospital nitrogen supply hose used at your hospital to the connector labeled Hospital Nitrogen Supply. Next, connect the AC power cord supplied with your ROSI system to the connector labeled Input 12 VDC. Now, turn to the front of your unit and press the power switch to the setup position. A white light will illuminate. Press the yellow button labeled Suction, and then the blue button labeled Irrigate. While maintaining sterility of the distal tubing set and the IV bag spike, peel apart the suction and irrigation limbs at the proximal end of the tubing set. Find the short, hazy section of the tubing set, which is tagged by a yellow strip at each end. Gently pinch this portion of the tubing and insert it into the pinch valve behind the yellow suction button. Now, find the short, hazy section of the tubing set, which is tagged by a blue strip at each end. Gently pinch this portion of the tubing and insert it into the pinch valve behind the blue Irrigate button. Make sure that the tubes are fully seated inside the valves. Now, toggle the power switch to the off position. The pinch valves will close to secure the tubing in place. At the distal end of the tubing set, close the clamp using sterile technique to prevent fluid passage until ready for use. Next, hook up the yellow connector at the end of the suction limb to the hospital suction canister. Now, turn your attention to the IV bag inflation cuff. Place an IV bag into the cuff. Using sterile technique, uncap the IV bag spike at the end of the irrigation limb of the tubing set and insert it into the IV bag. Using firm pressure, insert the air line of the IV infusion cuff into the connector labeled IV cuff on the control unit. This will cause the infusion cuff to pressurize to its proper inflation level. Finally, using firm pressure, insert the foot switch cable plug into the port labeled remote control jack. Press the power switch to the on position. A green light will illuminate. Open the pinch clamp at the distal end of the tubing set using sterile technique. Your ROSI system is now ready for use.